Welcome, and thank you for joining us for this next session. I'm really pleased to introduce to you Michelle Hammond, a leading wellness consultant and founder of Teapot, The Power of Touch. I'm going to hand straight over to Michelle. Thank you for joining us.
Hi, Erin. Thank you so much for inviting me. It's an absolute pleasure to be here, and for all of you for joining us today. As Erin said, my name's Michelle Hammond, and I'm going to be talking to you about the state of the nation and looking at what we can do to help people live longer, healthier, and more well. So aside from being a mum of two, I have spent the last 30 years in the health and wellness industry, starting first as a complementary therapist before moving into managing and directing spas and resorts around the world. I now spend my time in the last 15 years as a consultant and educational provider, so helping people really bring wellness to life, whether that's in the workplace, through residential communities, or for spas and salons. So you will hopefully see through this presentation that my passion lies in the miracle that is us and our bodies and our minds and the wonders of the human being. And I'm a massive fan of integrative medicine and what we can do as a wellness profession to elevate the integration of health and wellness more. And as we all know, never has there been a time that that is needed more. So the wonders of you. The world we live in is beautiful. I know we're doing quite a lot to be seen to be destroying it and damaging it at the moment, and we're all turned on to looking at what we can do to minimize that damage and to bring back the priority of leading with nature. And the world we live in is miraculous and amazing, but nothing more so than the wonder of you. Our ability as human beings, our bodies, our minds are incredible. And I think we need to do a lot more to celebrate that. And that's what I want to do in this session, is take us on a bit of a journey of what we can do to elevate and celebrate that more. So our eyes, the ears, the nose, the mouth, the hands, our head, our heart, these are the wonders that we have with us every moment of our day. So obviously there are some weird and wonderful facts about the human body, and I'm going to share some of them with you now. And there are many, but I have wrote a kind of list of some of the kind of key ones that I just think are an amazing sort of reminder. And I want you to just take a moment to kind of really think of yourself, like feel the wiggle of your toes and the wiggle of your fingers and the top of your head, and just kind of connect with your body, realizing that blood makes up about 8% of your total body weight. The human nose can detect about 1 trillion smells. If you live to the age 70, your heart will beat around 2.5 billion times, sorry. Your body has 2.5 million sweat pores. Every minute, you shed over 30,000 dead skin cells. Apparently, you're around 1 centimetre taller of a morning than you are at the end of your day because of how cartilage softens throughout the day. Your tongue is covered in 8,000 taste buds, each containing up to 100 cells to help you taste your food. Every second, your body produces 25 million new cells. That means in 15 seconds, you will have produced more cells than there are people in the United States. There is anywhere between 60,000 and 100,000 miles of blood vessels in the human body. And if that was laid out end to end, it would be enough to travel around the world more than 3 times. Your brain produces enough electricity to light a light bulb, and your hearing is the fastest of your human senses. Your brain can recognize around 10 times faster sounds than you can with the blink of an eye. And your eye blinks around 20 times a minute. That's over 10 million times a year. You have more than 600 muscles. Your kidneys filtrate more blood than your heart, liver, and brain, and your heart beats around 100,000 times a day. The average person breathes between 17,000 and 21,000 times a day. And on a genetic level, as human beings, we are 99.9% identical. Now, they're just some of the key facts of what happens without our conscious awareness in our incredible bodies all of the time. And actually, it doesn't ask for a lot, does it? Our bodies don't ask for much to enable us to do all the things we do. It asks of us to eat well, to move more, to sleep better, to be more mindful, to connect deeper with ourselves and with others and with our planet and the world around us, to love with all our heart, and to laugh loud and lots. So as wellness professionals, we know that these things don't take a lot, but actually they can be a lot to do consistently. And that's where sometimes we fall down. It'll be no secret to most of you that the population is aging. We are living longer, and there are more of us living on the planet than at any other time in history. But unfortunately, we're not living longer necessarily fitter, more healthier, or more well. And that's something we all need to do more about. Over the last few decades, we have seen a rapid increase in long-term illnesses and preventable health conditions. And actually, if we look back to generations like my grandmother, those generations typically experience chronic illness, but normally around retirement age, which back then was around 60. So around the age of 60, we started to see people developing chronic health conditions or leading into acute health conditions. But unfortunately, we're now seeing a whole array of these chronic health conditions impacting us much younger. And so the question becomes, is 40 becoming the new 60 when it comes to illness and dis-ease? So some of the key conditions we focus in on with TPOT and that we see impacting our aging populations around the world, and obviously even some of our children now with some of these conditions, are chronic conditions like cancer, like heart disease, obesity and diabetes, dementia, depression and burnout, prescription drug overuse, which is often not talked about, and substance abuse, respiratory diseases such as COPD, and of course, of late, viruses impacting us and the impact of them worsening as a result of other chronic conditions people are living with COVID. So I wanted to take some time to just kind of go through some of the key global statistics and facts around these key health conditions to help us kind of just position that framework into our minds before we start to look at what we can do about it. So just to give you some of the top lines with cancer. Cancers are responsible for around 10 million deaths per year. Globally, 1 in 6 deaths are due as a direct result of cancer. 1/3 of those deaths are due to tobacco use, high body mass index, alcohol use, low fruit and vegetable intake, and a lack of physical activity. In the UK, someone is diagnosed with cancer every 2 minutes. And I think these are really sobering statistics, aren't they? Because we know that only 10% of cancers are inherited, are genetically predispositioned for us to develop. So at least 4 in 10 cancers are preventable, are lifestyle activated and inhibited. And we have the power to do something about those at least. Heart disease. So the world's biggest killer is ischemic heart disease or coronary heart disease. And that's responsible for around 16% of the world's total deaths. Deaths from CHD have risen more than 2 million in the last 20 years. Now, that is in part because there are more of us and we are living longer, but also those statistics are because we are sitting more and we are not active or physically active enough in our day-to-day sort of work as well. And we're seeing the impact of that, obviously, in those heart conditions. 17.9 million people die each year from all cardiovascular disease combined, and that's 31% accounted for of all worldwide deaths. Obesity. Now, this is a big topic, isn't it? And one that, you know, we are seeing impacting not just us as we age, but also our younger people as well. At least 2.8 million adults die each year as a result of being overweight or obese. And I think that's a really interesting statistic in itself, because quite often we don't think about how weight kills. We just think about how weight can debilitate. But of course, being overweight does have implications to other chronic and acute conditions that come about. So it's a really key factor in the change we see, particularly in the Western and developed world. is undisputably the greatest preventable health-related cause of mortality. I say after cigarette smoking because that has always been the case, but actually the statistics are now showing us that actually obesity has overtaken cigarette smoking. One, because the culture of smoking obviously has changed massively in some countries more than others. So we're seeing less people smoke. And so, of course, heart-related issues and obesity have took that place. But worldwide obesity has nearly tripled since 1975. And I think that's a really sobering statistic. You know, in less than 40 years, we have seen a tripling of obesity, of a completely controllable condition that we're imparting on ourselves. So we know something's gone wrong in the way that we live and our approach to our overall well-being, and how we educate and respond to that message. In 2016, more than 1.9 billion adults were overweight, 650 million of those categorized as obese. Obesity is thought to be closely related to depression, and I think that's another really important factor. We are in what everyone is categorizing as a mental health crisis, exacerbated by COVID, and the way that COVID has impacted us over the last 18 months. But I actually believe we were in a mental health crisis for the last few decades. It's just we talk about it much more now and are much more active in our approach to dealing with it as individuals and communities, rather than through potentially health-related strategy. But obesity is directly related to people's reports of happiness and their anxiety, their stress levels and depression. So we know that these types of conditions can be a snowball effect for lots of other comorbidities too. 6% of cancer are also believed to be caused by being overweight and obese. And worldwide, over 41 million children under 5 were overweight or obese in 2016, 340 million children between the ages of 5 and 19. And I think that is an absolutely scary statistic that should make all of us stop and say, this has got to change. We have got to make fundamental changes to the way we promote health and well-being and to how we deal with sickness and disease more proactively and preventatively. It's believed that if that trend with obesity in children continues, that actually in just a few years' time, that statistic will be 70 million. 70 million children categorized as overweight or obese. And of course, we can all imagine the ongoing consequences to that through the lifetime. Diabetes closely related to obesity, because a lot of people that get type 2 diabetes, which is not the genetically inherent diabetes, are likely to be overweight. So we know there's a link there, and we know there's a link with COVID too, because we've seen that more people have had worsening effects of COVID or have ended up in ICU or unfortunately losing their lives as a result of being both overweight or diabetic. They're two of the biggest triggers with COVID. But every 7 seconds, someone is estimated to die from diabetes or its complications. Now, if that's not a pandemic, I don't know what is. I mean, every 7 seconds, 50% of those deaths occurring in people under the age of 60 years old. Diabetes is the silent epidemic. It claims around 4.2 million lives around the world each year, almost 3 times as much as COVID has to date. Deaths from diabetes have increased 70% globally in the last 20 years, and there's an 80% rise in deaths among males, which is really interesting. So when we delve into that, we can see that lifestyle factors play a big part, but also we've seen a huge shift between more manual workers and more sedate workers, people that are desk bound. And that shift alone has obviously caused a huge change in the way our bodies move, in the way we then approach food, the types of foods we grab when we're sat at the office desk. I remember my husband, when we first moved to England, mortified by the whole sandwich deal sort of scenario, being able to grab a sandwich, a packet of crisps and a can of Coke for an incentive price. And he was just like, that's not food. Who would have that for their lunch? But unfortunately, in places like the UK, that has been a staple diet for most people's lunch for a very long period of time. And of course, those choices have consequences. Diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputation. And actually just here in the UK, over 135 people a week have a limb amputated as a direct result of diabetes. So this is a conversation we need to have much more openly. Heart diseases and strokes are also 3 times more likely if you're diabetic. So again, it's that cumulative effect, isn't it? When we have one chronic illness, we open ourselves up because our body is weird and wonderful and this amazing thing, but it's intricative. It doesn't work in silo. Our circulatory system doesn't work independent to our lymphatic system. Our lymphatic system doesn't work independent to our respiratory system or our urinary system or our hormonal system. These things work in synergy. So when one goes off kilter, it has no choice but to have a knock-on effect to everything else. And that's what we then see over time occurring. We have dementia. So of course, with an aging population, inevitably, diseases like dementia are going to occur more widely. 50 million people have dementia, 10 million new cases every year. Alzheimer's obviously being the biggest kind of part of that story. But we're also seeing people get dementia much younger. You know, in fact, actually, I worked for a residential retirement company for many years, designing some of their spaces around the UK, trying to revolutionize retirement living. And one of the first jobs, having not worked in the retirement sector, was to visit existing retirement homes, existing nursing homes, and look at the existing state of play. And quite often I would walk into some of these places, which were not as inspiring in any way, shape or form. And I would be greeted by relatively young people sat there. I mean, people in their 50s and mid 50s and 60s. And I would think they were visiting. And quite often was then absolutely amazed to find out that actually that wasn't the case at all. They were actually inpatients. They were living with the early onset of dementia, or had quite progressive dementia. So, you know, this is not just an old people's disease anymore. It is happening to younger people too. And we're seeing the impact of that. Globally, the numbers of people living with dementia are set to increase by 204% up to 2050, with 152 million people sort of increasingly getting the disease. Now, some of that is still misunderstood. We don't always know why people develop dementia, but what we do know is light, exposure to light, and dental health, sleep, our diet, how much we were moved, and how much we monofocused in our lives plays a part. So actually there is a link between, you know, sort of some extreme academia and some severities of dementia, because it's believed that it's that constant multitasking, morning to night, you know, that your just natural way of being, that also can, you know, sort of create issues with our brain and our memory, which is why mindfulness and meditation has such great impact, doesn't it? It restores us, it rebalances us, it enables us to reconnect with ourselves. And it kind of is a bit like a charge, I always think, for the brain. It gives it an opportunity to get a boost and to get sort of restored and rebalanced before we put more pressure on it. We have depression and burnout. So of course, depression is being talked about a lot in the media at the moment amongst this mental health crisis. So depression is a leading cause of disability worldwide. It's a major contributor to the overall global burden of disease. But as I mentioned earlier, I think we've been in a mental health crisis for a very long time, and unfortunately now just kind of feeling the kind of pain of that. And that's because we're in this kind of fast-paced, constantly connected world, and most people don't know how to press stop or pause, get off and kind of reconnect. And the upside of COVID is most people have found ways to help themselves and have found ways to reconnect with nature, reconnect with what's important to them, realize that working every hour is not conducive to their overall health and well-being, that actually going for walks, exploring their area, socializing with friends, these are the things we craved and wanted and missed most through that period. And that obviously has a really positive impact in our health and well-being and reduces some of those really scary statistics. And I think the really scary thing about some of the depression and suicide rates is, again, the ages that we're seeing them. You know, teenage kids, you know, particularly males, are some of the biggest numbers of suicides actually happening in the Western world, and actually perimenopausal women. as well. You know, we're seeing this real shift across the sexes and throughout all ages being impacted. So again, something we all need to address collectively, because it is not just discriminating against any one sort of group or age range. And then, of course, we have respiratory diseases and disorders, another big area and challenge, and of course, particularly relevant to halotherapy, although actually all of them are, because again, the healthier we are, the more well we are, the more likely we are to not have the snowball effect of chronic disease. But 328 million people living with COPD around the world, expecting to become actually the leading cause of death over the next 15 years, as predicted by WHO. So we have some real work to do there. Air quality, of course, from pollution will play a part, both internal and external, but of course there is stuff we can do to strengthen our respiratory system, and of course try and reduce the amount of airborne allergies and aggravators that are causing the long-term exposure to some of these greater risks. Survival rates for people with severe COPD actually can be worse than some of the many common cancers that are now being treated and people are living much longer and more normally with. Again, more of risk of other sort of lung cancers and other chronic conditions. If you are living with conditions like COPD, you're vulnerable. And so, of course, the onset of the condition can cause a tag effect. Asthma also affecting over 300 million people, and again, one of the biggest chronic diseases we see lifting among children, and again, something that we can do more of by getting them outside, getting them into nature, and obviously learning how to sort of move well and eat well for their lung health. Prescription drug and substance abuse. So just to go through a few of these, because I think this is more food for thought, but it's actually up until recently, you know, it was actually the number 3 biggest reason of death globally, and we underestimate. Now, I'm a massive fan of modern medicine. I'm a massive advocate for science, and you know, we live in modern times, and I'm very grateful for the opportunities that modern medicine has given all of us to live longer, healthier and more well in many cases. But unfortunately, there are some chronic conditions that we just don't deal well with through medicine alone. I mean, diabetes is a prime example. For many years, the medical profession believed that diabetes was only treatable with medicine, and once you've got it, it was kind of irreversible. We now know that's not true, and many people in as little as 12 weeks with a good exercise plan, good diet, you know, personalized for their specific needs, can actually reduce, if not come off of their diabetic medication based on being type 2 diabetic. You know, so there is a lot we can do, but 48% of people are now believed to be on some form of prescription drug regularly. That in itself should send alarm bells for all of us. Medication for diabetes, high blood pressure are obviously some of the most commonly prescribed, along with statins, indigestion remedies, painkillers, of course, antibiotics, which we know we're now becoming more and more resistant to, and of course, antidepressants, which unfortunately do seem to be given out way too freely and for way too longer periods of time. I'm a psychotherapist by training too, and I'm a massive advocate for antidepressants. If you are struggling, if you are in a place where you cannot be yourself and you cannot think straight, I always imagine it's like being in the really dark river and the waves kind of coming through and the tides taking you down. You have to have a life buoy thrown in and someone to drag you out. And that's kind of what the antidepressants role is. It's to kind of get you out of the dark, cold, deep water where you're in danger and to bring you to shore and get you safe. Once you're on shore, we need to find other remedies to help you get off the antidepressants and get you back to yourself and back to your new way of being and healthy and sort of well. So antidepressants were never supposed to be a long-term fix. So when people are on them for 20 years, 30 years, 40 years, that in itself is a red flag. And we need to be looking at how we address that sort of more effectively. In the course of a lifetime, a healthy person could easily consume from upwards of 10,000 pills. And I think I really want you to just hear that again. The average person a healthy person could easily consume upwards of 10,000 pills in their lifetime. In the UK, it's not uncommon for the over 65s to be on between 6 to 12 tablets a day. And some of those, as we know, are to counter the effects of some of the other drugs that they're on, and it becomes a bit of a spiral. But I think it's really important that we work to integrate with modern medicine and science, but we also look at some of the areas where we could, through education and through support, get people doing more for themselves, so that we can use those funds and that cost and those resources in the areas of acute care, and where obviously the only remedies are prescription-based support. Substance abuse, obviously, 35 million people now believed to be suffering from some form of drug disorder, whether that's smoking, alcohol, illegal drugs. Collectively, people are using these crutches more to quite often compensate for the way they feel and the way life is for them, and the pace of life. And again, there's lots of ways we can address that. It's a really challenging and difficult conversation, but as you see, 11.8 million people are killed, using sort of substance abuse drugs. And higher than some of the numbers of cancers, and we're seeing that impact younger and younger as well. So just then a quick sort of final slide on sort of COVID before we look at sort of what we can do. But as of the 17th of November, there were 254 million sort of confirmed cases of COVID, over 500 million sort of deaths reported to WHO. Some of the other statistics there on vaccines, 10 times more likely to obviously be impacted if you're overweight, obese, and as we know, sort of diabetic too. In fact, a US report suggests that 40% of people who have died from COVID in the US had type 1 or type 2 diabetes. And there are more studies happening all the time. Even here in the UK, over 2 million people in England are thought to have COVID symptoms that are lasting now more than 12 weeks, as we talk about sort of long COVID and what that means for people and the impact of that. And we are definitely seeing that impact in people that had a form of comorbidity already. So again, it's that snowball effect sort of coming into play. So we can't change the fact the population is aging. That's a good thing. We want us living longer, but of course we want us living longer, healthier and more well. None of us want to be heading in to our middle age or retirement years and not able to enjoy them. We want to live, don't we? We want our bodies to be free to move, our minds clear to think. And so we have to kind of do that consciously and considerately and consistently over periods of time to get the benefits. The associated rise in cost and implications are inevitable if we stay on this more reactive sort of sick care, as I call it, sort of pharmaceutical-led well-being. And as I say, that's not to bash pharmaceutical, that's just to say if we put the power of our health and well-being in something outside of ourselves, then actually that's really disempowering. And that's really disempowering to what is an incredible piece of work. Your body is amazing. It has amazing abilities to heal itself and help itself. And as we talked about at the beginning, it doesn't ask for a lot to do that. Some really simple, quite basic sort of actions from us that aren't always easy done consistently, and not in a culture or an environment that doesn't respect what it means to be well and to how we go about that. So we have a really important part to play. Wellness matters more now than ever. And it's our job, I believe, to elevate and celebrate what wellness can bring and to put the science behind it, because that's actually one of the biggest reasons that people believe in the types of things we do, because quite often it can be seen as woo-woo or sort of nice to haves or pampering or, no evidence, no science behind it. But actually we have opportunities now to evidence what we do. And even things like halotherapy, we can evidence, even if anecdotal. We have 50 people going in to our halotherapy units that have a particular condition, and we can monitor them and track them, even just by their own incidental reporting on how they're feeling better or not. And we can report on that, then this gathering of data becomes really powerful. And that's what it will take for us to really evidence what we can do from a wellness perspective. You know, we've got to do more to educate prevention and to talk about how all of the resources we have within the wonders of wellness can help people prevent getting these disorders and diseases in the first place, and of course how they can live better with them and manage them better if they do already have them. And that comes from really personalized and prescriptive care. And that's where technology helps us, doesn't it, as well, because we are in a position now where we can personalize medicine and personalize a response to someone better than ever before, because we have the tech and the data enabling us to do that. So it's how we leverage that in a really positive, proactive and powerful way that can help us make a real difference and become a really integrative part of the solution, not just a kind of an alternative route for people that maybe you know, want to choose a different path. We're seeing more and more insurance companies starting to incentivize well-being, and many more employers as well, starting to look at actually how do they reward their teams and the people that they sort of have policies for to look after themselves more and to do better. And I think most people, when shown the impact of what they can do in really small bite-sized steps, feel empowered to kind of do more. When it feels like a massive mountain, you know, we talk about it not being a lot, but actually day to day, you know, who lives so perfectly? You know, we all know what it means to be well, but education isn't enough alone. It's the application of that knowledge that's really powerful. And so if we can support people on a day-to-day basis, our clients, our colleagues, our communities, and inspire them by showing them the difference just one session can make, let alone 3 sessions, by making one better choice over time, the impact that can make. If they can see those results and they can see that impact and ultimately feel it for themselves, then of course we have a win-win scenario going on, and that's really important. And I just think that in all the work we've done, you know, I've never found anyone who doesn't really understand what it means to be well. They know they have to move more. They know they need to eat better, sleep well. People appreciate that socializing and connecting with loved ones makes a massive difference to their health and well-being. Being in nature makes them feel good, but it's finding the time and it's managing it and it's putting it into your lifestyle in a way that's right and relevant for you, that's going to make the difference. And that's what we can do as kind of wellness warriors, is support people to look at how they can make it work for them in a really personalized and prescriptive way. So I'm a massive believer that the solution is within us all, that we all have the power to do more, and we can only start where we are with what we have. And I think that's a really important message. We can all do more for ourselves and for people we love and care about, and the people in our care, our clients, our colleagues, and of course, people in our wider communities. And so the question becomes, what can you do? Think about it from your perspective as an individual, as a business owner or operator. What can you do to help people feel more empowered to look after themselves? How can you demonstrate the benefits of what you do and how it will impact that individual in bite-sized pieces and in understandable language more in your operation right now? And then, of course, the question is, what will you do? So again, knowing what you can do and knowing how you could promote it, how you could elevate it, how you could inspire people around you. But what will you actually do? What are the things you're going to take away to go and put into your business or to do differently to make the difference to the people around you? So there we have it, a brief whistle-stop tour through all of the kind of key conditions and obviously the impact they are having on all of us and what we need to do to focus on a more integrative health and wellness solution moving forward. You can learn more about me and Teapot at tpot.org.uk. And we also recently ran a really intensive cancer care conference, which talked about how to integrate health and wellness more effectively, specifically for people living with and beyond cancer, but it also delves quite deeply into all chronic diseases, both from your built environment to the way we talk and communicate, to how we obviously curate things like sound and scent as well. And for the World Halotherapy Association, we put a discount code there for you, which you're more than welcome to access the whole content, over 30 speakers for just £29 for the next 2 weeks. And to say thank you for joining me, thank you for being present, and to remind us all that there are many wonders in the world, but the 7 wonders I think we need to celebrate more are the ones that enable us to see, to hear, to touch, to taste, to feel, to laugh, and of course to love with all our hearts. Thank you so much. I've been Michelle Hammond, and it's been an absolute pleasure to spend some time with you.
Wow, Michelle, that was incredible. What a lot of information there you've given us, some wonderful food for thought. It is quite scary to see just what kind of state our nation or our world is really in from a health perspective. And I really do believe that we can all make a difference, and we as people who provide halotherapy can also make a difference. I see us as, you kind of touched on it, we're a complementary therapy. It's to be used alongside other things. We're not a replacement, but I've heard so many wonderful stories leading up to this conference about, you know, people who are seeing clients being able to put prescription medicines to the side because the halotherapy has worked. So I would really love it if anyone has some wonderful testimonials, get in touch with me. We need to spread these. These are what we need to share. We need the real life testimonials from people to help tell other people what experiences they've had and show that it is possible to live a better life. And really, education is certainly key, isn't it? And that's again what the WHO wants to get out there, is we want to really help educate the world to the benefits of halotherapy and how other people can consider us as part of their treatment plan or offerings. And you touched on there, Michelle, about COPD. I really didn't realize those numbers were so huge, but I did hear an amazing story the other day from Tammy at the Carilion in Miami, where they had a COPD patient who, I think he was a resident, and he signed up to coming 90 days. The first day he came in and he showed them how many medicines and prescription drugs he had, and it was a big bundle of them. After 90 days of consistently going and doing this halotherapy, he came back and he showed them he only had half of the medication. He was so positive about his experience that he continued for an entire year. And at the end of that year, he wasn't on any medication anymore. And I'm not saying that that's going to happen for everybody, but you know, it's worth a try, isn't it? You know, these complementary treatments are definitely worth a try.
It really is worth a try. And I think, I mean, we, you know, most of us in the Wellness Ninja banged this drum for a very long time. And obviously, you know, that's great. It's being heard now and it's resonating deeper now than ever before. And actually, one of the things we talked about in the Cancer Care Conference was the Department of Health here in the UK has actually just issued new guidelines to GPs across the UK to say that actually prescription drugs should not be our first line of defense for many things. And that's the first time that's ever been written by the Department of Health within the health and medical profession to say that actually, look, there are times where it is absolutely needed. And of course, you know, as I said, I'm a massive advocate for modern medicine. And you know, I always say to people, if you've got chest pain or anything, dial 999, get yourself to A&E. Don't be looking to go and do some sort of breathing exercise or some mantras or meditations. You know, that's the place you want to be. But we're not as good at dealing with chronic conditions. But to see that even the Department of Health are now starting to recognize, mainly because they realize it's not financially viable, but they are starting to recognize that actually this is not the solution. Putting people just on more and more medication is not the solution, because we are disempowering every step, and it costs too much, and we just can't afford to do it. But also the quality of life is really important. So, you know, medications are fine, but by integrating and working alongside complementary practitioners, that should be the goal always, is to use medication where we need it, but to enable people to come off it in a tailored program, integrative with their medical team. That should absolutely be the goal. So it's lovely to hear stories where somebody has slowly but steadily, consistently applied their complementary technique and has now reduced and reduced and reduced until they're at 0.0, which is, it's success, isn't it? That's what success looks like.
That's right. And absolutely, that's great news to hear, that physicians are starting to adopt these or recommend them to their patients, and that's really where halotherapy came about in Poland, with a physician who discovered that people were healthier, the ones that had been working in the salt mines, and he even then started prescribing to his own patients to go into the salt mines to get the respiratory benefits. So it's almost like a full circle. It's coming back.
It's coming back. I always feel like when you study Chinese medicine, Ayurvedic medicine stuff, I feel like we slept for a big period of time, and we definitely took the power outside of ourselves. But I think we have awoken to the realization that we can do a lot for ourselves using what we have where we are.
And if you want to find out a bit more about bringing vitality to humanity, Ariel Jarvis is doing a talk later today, so tune into that one too. But thank you so much thank you so much, Michelle, for joining us today. We really appreciate you giving us your time and your insights.
That's an absolute pleasure. Thank you so much, and lovely to be here with all of you.
Thank you.